Hello, Dr. Joe here of the drjoe.com. So every now and again, I get people write to me wanting me to do a video on low blood pressure, and up until now, I have been reluctant to do a video on it, only because my passion is mainly about high blood pressure and control of high blood pressure. But I've had to cave in because I believe that these folks who've got problems with low blood pressure deserve to be heard and helped. So I have today decided to do a video on low blood pressure. So what you're going to get in this video, where you're going to get the definition of low blood pressure. I'm also going to talk about the symptoms of low blood pressure, as well as I'm going to give you tips on how to deal with your low blood pressure issues if that's a problem of yours. So let's get started. So what is low blood pressure? Well, by definition, low blood pressure is when your blood pressure reading is below 90/60. But I have to say, you've got to put this into context because, for instance, in our antenatal clinic, where we see pregnant ladies, we see pregnant ladies who run blood pressure readings of 80/50, and they're fine, okay? They don't have any symptoms, and we don't have to do anything about it. So the whole thing has to be put into context. The point being, if your reading is below 90/60, does not mean you should go into a panic. Because if you don't have any symptoms, then you don't have to worry about it. Okay, so just something to bear in mind. But by definition, blood pressure readings of below 90/60 will be considered low blood pressure. So what are the symptoms of low blood pressure? Well, there'll be things like lightheadedness or dizziness, which can lead to fainting. You might feel weak. You might have confusion. You might have blurred vision. And in the elderly, that could also lead to falls. Okay? So those are some of the symptoms that you will experience if you've got low blood pressure. So what can you do about it? Well, if you've got low blood pressure, the first thing you want to do is see your doctor, okay? If it is a problem, see your doctor. The idea behind that is that your low blood pressure needs to be investigated to find out a cause as to why your blood pressure is low. Because it's possible that a simple change could just be all that is needed. So for instance, it may well be that a medication that you're taking is the reason why your blood pressure is low. So your doctor just reducing the dose of that medication or stopping the medication altogether will mean your low blood pressure problem is over, okay, completely resolved. So see your doctor to have your low blood pressure issue investigated. That's the first thing you need to do. Now, what else can you do to help yourself if you've got low blood pressure? Well, drink more water, okay? You need to drink more water. The reason is when you drink more water, you're going to increase your blood volume. That will raise your blood pressure. That will correct your low blood pressure. And also it will prevent, drinking more water will prevent dehydration. And if you're dehydrated, that will correct your dehydration. So drink more water. That's your first tip. Your next tip is for you to buy yourself compression stockings, okay? Or what we call support stockings. These are the stockings that we give to people who've got varicose veins. And also when people are coming in for pelvic surgery, so surgical procedures like colorectal surgery, gynecological procedures like hysterectomies, we usually give them to these patients to wear on their legs. And the idea behind all of this is that the compression stockings will compress the veins, and that will promote the return of blood to the heart. That will increase your blood volume, and that will correct your low blood pressure. So buy yourself compression stockings or support stockings. So that's tip number 2. What else can you do? Something else you can do is to elevate the head of your bed, okay, by about 6 inches. Just get some bricks or blocks or books, put them on the head of your bed to elevate it by about 6 inches. When you do that, you are raising the head of the bed, and that will help you with your blood pressure. And in fact, that leads to my next tip, which is to change your position gently and slowly. So what you don't want to do is change your position very quickly. So if you are lying down and you want to get up, you need to do it in steps, okay? So get up into the sitting position gently, first of all. wait for a couple of seconds, and then before you stand up into the upright position. So if your head of bed is already elevated, you haven't got long to go into the sitting position. So those two tips are actually linked. So if you want to change your position, don't do it abruptly, do it gently and slowly. So what else can you do? Well, you want to spread your meals over the course of the day. So eat frequent small meals, okay? And the other thing too is you want to limit your intake of starchy carbs. So starchy carbs like bread, pasta, rice, potatoes, you want to limit the portion sizes that you eat, because sometimes they can lead to autonomic changes that will lead to a drop in your blood pressure if the sizes are enormous. So limit the size or the portions of your starchy carbs, okay? So what else can you do? Well, you don't want to stand for prolonged periods, okay? Because the idea behind that is when you stand for prolonged periods, there's going to be pooling of blood in your legs, and that means not enough blood is being returned to your heart, and that will reduce your blood volume, and reduction in your blood volume will mean a reduction in your blood pressure. So don't stand for prolonged periods. But if you have to, for whatever reason, what you want to do then is to pump your calf muscles. So you just need to flex your knees often, pump the blood. That will encourage the return of blood to your heart, and that will raise your blood pressure. Okay, so you want to do that. What else you want to do? You also want to limit your alcohol intake, because alcohol does lead to dehydration, and dehydration, of course, will lead to low blood pressure. So limit your intake of alcohol. What else can you do? The next tip is for you to increase your intake of salt. Now, you've got to be very careful with this tip, because you must involve your doctor in this decision, because if you're going to increase your salt intake over a long period of time, that can lead to heart failure. So the situation needs to be monitored, and that's why you need to get your doctor involved in that decision. What else can you do? Well, you also want to increase your caffeine intake, okay? Now, caffeine does raise blood pressure, but you also want to be careful with this, because caffeine can make you pee often, and peeing often means you could get dehydrated, and that will be counterproductive. So increase your caffeine intake. However, you need to match this with increased fluid intake as well. So you want to drink a lot more to correct or increase your blood volume, if you like, and that will correct your low blood pressure. So increase your caffeine intake, but also match that with an increase in fluid intake, okay? So those are your remedies for correcting your low blood pressure. Hopefully you got some value from this video. If you did, please give the video a thumbs up, please like the video, and also please share this video with your friends, family, and colleagues. If you got any comments, any questions, leave them down below. And if you haven't joined us yet at the 2020 Forum platform, please do so. We discuss wellness issues, and that will include, even now, low blood pressure issues, but in particular we tend to talk a lot there about high blood pressure issues. There should be 2 videos on your screen now. Go ahead, click to watch any of the 2 videos, and because they are videos that are designed to help you take control of your health. I think that's about it. Until next time, well, this is Dr. Joe signing out.